Hi, I am Dr. Kumar, Anesthesia consultant practicing in Jayanagar Cloudnine and Kanakpura Cloudnine. The pregnancy is considered high risk when it is associated with certain medical conditions that have a potential complication on the mother or the baby or both. The certain medical conditions like hypertension, diabetes, obesity, heart problems, autoimmune disease and the kidney. So these tends to have a potential complications. In this, each patients are considered individually and the choice of anesthesia depends upon them. For example, now the patient pregnancy is associated with hypertension. In them, if the blood pressure we assess, if the blood pressure is uncontrolled and there are associated with certain complications like fits or seizures, and also the blood clotting factors are abnormal, then we give general anesthesia. If the blood pressure is controlled and the clotting factors is also within the normal limit, then the choice would be a spinal anesthesia. In case of a diabetes or obesity, the choice of anesthesia would be a spinal anesthesia until there is no contraindication. Then in the case of heart problems, when the pregnancy is associated with the heart problems, we do initial blood investigations and also do a heart scan called as echo. A cardiologist is involved. If the heart involvement is on a milder form, then the spinal or the epidural is considered. If it is on a moderate to severe, then we consider a general anesthesia. In certain autoimmune disease like SLE, where it is a multi-organ involvement, we assess with the blood investigations. If the blood investigations is within normal, we give a spinal. If it is deranged, then we give a general anesthesia. Next, we have what is called as the multiple sclerosis. In multiple sclerosis, it is a neurological involvement. Here, the choice of anesthesia would be a general anesthesia. If necessary, post-operative pain management is taken care with the help of an epidural. The spinal is avoided. When the pregnancy is associated with certain kidney problems, so here the blood investigations is done, and in order to avoid the multiple drugs, if the blood investigations is within normal limit, the choice would be a spinal anesthesia. If the blood investigations is deranged, then we give a general anesthesia.